Ever forgotten where you placed your keys? That's common. But what if you forgot significant events or personal information? This is not just forgetfulness, it could be dissociative amnesia. Dissociative amnesia is a fascinating and complex mental health disorder that involves gaps in memory of personal information and life events. These aren't your everyday gaps that come from being a little scatterbrained. These are significant lapses that can't be explained by ordinary forgetfulness. Imagine having a book where entire chapters are missing. You remember the beginning, you know the end, but the middle is just gone. That's what dissociative amnesia can feel like, and unlike that lost set of keys, these memories aren't just misplaced, they're inaccessible, locked away somewhere in the mind's labyrinth. Now let's get into the nitty-gritty of what dissociative amnesia is. It's a type of dissociative disorder, which means it involves a disconnection or lack of continuity between thoughts, memories, surroundings, actions, and identity. Dissociative disorders are thought to stem from trauma, and dissociative amnesia is no exception. So how does it differ from everyday forgetfulness? Well, with dissociative amnesia, the gaps in memory are more profound, more pervasive. We're not talking about forgetting an appointment or misplacing your glasses. We're talking about not remembering years of your life, significant events like weddings or births, or forgetting important personal information that most people would recall easily. But don't rush to conclusions just yet. Everyone has moments of forgetfulness. It's a part of being human. Dissociative amnesia, however, is a rare condition. It's not something that everyone or even most people will experience. Remember, dissociative amnesia goes beyond forgetting where you left your keys. It's about losing access to significant personal information. And it's just the tip of the iceberg. In the next segment, we'll delve deeper into the diagnostic criteria of dissociative amnesia, so stick around. You'll discover more about this intriguing mental health condition, and who knows, it might just change the way you think about memory. Now, you're probably wondering, how do professionals diagnose dissociative amnesia? It's not as simple as a blood test. Indeed, diagnosing mental health disorders like dissociative amnesia requires a deep, nuanced understanding of the human psyche. It's not about checking off symptoms on a list, but rather understanding the person as a whole. According to the Diagnostic and Statistical Manual of Mental Disorders 5th edition text revision, or DSM-5 TR, the primary diagnostic criteria for dissociative amnesia involve an inability to recall important personal information, usually of a traumatic or stressful nature, that is too extensive to be explained by ordinary forgetfulness. This is not a case of, where did I put my keys, but rather, why can't I remember significant parts of my past? The information that is forgotten is always personal, significant, and often related to trauma or stress. It's not about forgetting random facts or general knowledge, but rather, it's about significant gaps in one's personal history. Importantly, the amnesia is not due to a medical condition, like a brain injury or a neurological disorder. It's also not due to substance use, and it's certainly not a deliberate act. It's a genuine and often distressing inability to recall important personal experiences. The diagnosis also requires that the amnesia causes significant distress or impairment in social, occupational, or other important areas of functioning. It's not just about the memory loss, but about how it affects the person's life. Lastly, the disturbance is not better explained by another mental disorder, such as PTSD, major depressive disorder, or another dissociative disorder. This is where the expertise of a mental health professional is critical. They can distinguish between different disorders and ensure that the diagnosis is accurate. Remember, these are just the criteria. Each person's experience with dissociative amnesia is unique. There is no typical case of dissociative amnesia. Each person's journey is their own, and understanding that journey is the key to diagnosis and treatment. Diagnosing dissociative amnesia requires a thorough understanding of a patient's symptoms and history. Self-diagnosis can be misleading and potentially harmful. So let's leave the diagnosing to the professionals, shall we? What causes dissociative amnesia, and how would you know if you or someone else might be experiencing it? Well, let's delve into that. Dissociative amnesia is often linked to severe stress or trauma, such as accidents, natural disasters, war, or personal adversities like abuse or bereavement. The mind, in its attempt to protect itself, might temporarily block out these distressing memories, leading to gaps in memory recall. Now let's move on to the symptoms. The most prominent symptom of dissociative amnesia is, of course, an inability to remember information about oneself or past events, especially traumatic ones. This is not the usual forgetfulness, like misplacing your keys or forgetting an appointment. It's more akin to forgetting significant personal details, like your own birthday or where you live. Imagine, for instance, a war veteran who can't recall certain periods of his service, or a survivor of a car crash who doesn't remember the accident at all. These are examples of how dissociative amnesia can manifest. Beyond memory loss, other symptoms might include confusion, emotional distress, and even identity confusion. Some people might find themselves in a place without any idea how they got there, a phenomenon known as dissociative fugue. It's as if they are detached from their own life, like a character in a movie they don't recall auditioning for. One thing to note is that these symptoms can vary greatly from person to person. They may come and go, and they may last from days to years. It's also worth mentioning that dissociative amnesia is not a result of a medical condition or substance use, which sets it apart from other types of amnesia. Recognizing the symptoms of dissociative amnesia is the first step towards seeking help. Remember, it's not about assigning blame, but understanding the situation. It's about acknowledging that the mind, in its infinite complexity, sometimes uses forgetfulness as a shield against pain, and that's okay. Once we understand this, we can begin to seek appropriate help and take the steps towards healing. Dissociative amnesia might seem overwhelming, but there are treatment options available. It's important to remember that each person's journey to recovery is unique, and what works for one might not necessarily work for another. The primary approach to treating dissociative amnesia is through therapy. Cognitive behavioral therapy, often referred to as CBT, is a common method. This form of therapy helps individuals understand and change thought patterns that lead to harmful behaviors or feelings. Imagine someone named John, who suffered from dissociative amnesia after a traumatic event. Through CBT, John was able to understand and alter his thought patterns, which helped him regain his lost memories. Another form of therapy is eye movement desensitization and reprocessing, or EMDR. This therapy is specifically designed for individuals dealing with trauma and can be beneficial in treating dissociative amnesia. Picture a woman named Sarah who experienced dissociative amnesia following a car accident. EMDR therapy helped Sarah process her trauma, allowing her to regain her lost memories. Psychotherapy, also known as talk therapy, can also be beneficial. This involves talking through your experiences and feelings with a mental health professional, which can help in understanding and managing symptoms. Consider Paul, who began to lose chunks of his memory after a family tragedy. Through regular psychotherapy sessions, Paul was able to come to terms with his loss and gradually started regaining his memories. In some cases, medication can be used alongside therapy. Although there's no specific drug to treat dissociative amnesia, medications like antidepressants, anti-anxiety drugs, or certain types of sedatives might be used to help manage any underlying conditions such as depression or anxiety. Remember, the journey to recovery may be long and challenging. It's essential to have a strong support system in place, be it family, friends, or support groups. Reach out to mental health professionals who can provide guidance and assistance. While dissociative amnesia is a serious condition, recovery is possible with the right treatment and support. Yes, it might be a long road, but with patience, persistence, and the right help, those suffering from this condition can regain control over their lives. Understanding mental health disorders like dissociative amnesia is crucial, but where can you learn more? This is where PsyEduInsights steps in. PsyEduInsights is your go-to platform for psychological education. We are committed to breaking down complex psychological concepts into easily understandable content. Our mission is straightforward: to make psychological education accessible to everyone, irrespective of their background or level of knowledge. We believe that understanding the human mind is not a privilege but a right. We aim to demystify the intricate world of psychology and bring it within the reach of anyone curious enough to explore it. Our resources are diverse and comprehensive. We offer a range of videos, articles, and podcasts, all designed to provide you with a well-rounded understanding of various psychological concepts. From mental health disorders to the latest research in psychology, our materials cover it all. One of our key focuses is to shed light on mental health issues like dissociative amnesia. We strive to present the information in an engaging and informative manner, making it easier for you to comprehend the disorder's definition, diagnostic criteria, causes, symptoms, and treatment options. But we're not just about providing information. At PsyEduInsights, we believe in the power of community. We foster an environment where people can share their experiences, ask questions, and learn from each other. It's a safe space where you can engage in meaningful conversations about mental health. Moreover, we continuously update our resources to ensure that they're in line with the latest research and developments in the field of psychology. This way, you can be confident that the information you're getting from us is both accurate and relevant. So, whether you're a psychology student, a curious individual, or someone seeking to understand their own mental health better, PsyEduInsights is here to guide you on your journey. With PsyEduInsights, you're not alone in your journey towards understanding mental health. Thank you for watching, and please subscribe for more insights into the fascinating world of psychology.